On the day of surgery, the patient will arrive early in the morning and they'll be processed through the administration and then go to the preoperative area prior to surgery where they'll be prepared. And anesthesia will talk to the patient. They'll start an IV and other things like that. The surgery itself doesn't take very long. My part's only about 45 minutes, but the entire trip to the operating room, including the recovery room, is probably somewhere around 2 hours. When the patient goes to the recovery room, I'll go out and talk to the patient's family or friends and let them know how the surgery went. After surgery, the patient will go from recovery room to the floor. Within 4 hours of the end of the surgery, we'd love to have the patient up and walking. This is very important for avoiding some problems, particularly blood clots in the veins of the legs. After 4 hours, the patient can have something to drink. We start with a clear liquid diet that's low in sugar, so the patient can have iced tea, they can have broth, they can have other things of that nature the evening of surgery. We will keep the patient in the hospital overnight. This is to check their vital signs and make sure there's no signs of bleeding prior to being discharged the following day if everything is normal. At the time of discharge, the patients will be given a prescription for pain medication. They may or may not have a local anesthesia catheter, which they'll go home with and will be removed the following day. When the patient goes home from the hospital, they will stay on a clear liquid, low sugar diet for the first week. Nothing soft, nothing solid, and nothing too sugary. For example, no apple juice. In addition, the patient will probably need to take some of their medications that they're on prior to having the surgery. It's our practice to reduce any diabetes medicine to 1/2 the usual dose. This is because the patient is on a liquid diet and therefore not taking as many calories and not likely to have as high a blood sugar as before. If the patient's on medication for blood pressure or for heart disease or an arrhythmia, we want them to continue this medication at home the first week. They need to crush the medication and take it with a liquid. We do not want them to take whole pills. Other medications can be skipped the first week. For example, high cholesterol medication or supplements do not need to be taken the first week, and we can wait until 7 days after surgery to start those. The patient will come to the office 1 week after surgery for an evaluation where we'll examine their wounds to make sure everything else is okay. And then we will change the patient to a soft diet. My definition of soft is anything the patient can mash up with a fork. Of course, the diet needs to be low fat, low sugar, high protein, and high fiber. Also, 1 week after surgery, we want to start a multivitamin, one that has folic acid, and we'd like to continue the patient on extra calcium with vitamin D. These two supplements are important. They're to be taken every day for the rest of the patient's life. We'll see the patient again at 1 month and switch them to the solid food, low fat, low sugar, high protein, high fiber diet. So any consistency food is allowed at this point. And we will see the patient again at 3 months, 6 months, a year, and every year after that. We'll check the patient's laboratories to make sure they're not getting low on a variety of vitamins and minerals. The first year is a little busy, but then it's just once a year visit after the first year. If you have any questions or need any other information, please visit our website or call your surgeon's office.